Hello, my name is Patricia LaBrosse, and I am the chairperson for the Louisiana Nurses Political Action Committee, better known as LANPAC. We have been conducting interviews with candidates for various seats in our state legislature, both House of Representatives and in the Senate. And we want to give you answers to questionnaires that we have sent out to them. Before we sent out the questionnaires, we had polled the Louisiana nursing community to see what issues were important to them. And then we narrowed that down and came up with a short six item questionnaire, because we've come to find out that our candidates are being bombarded with all kinds of questionnaires and surveys. And so we appreciate those who have answered the survey, and then those who wanted the opportunity to have their interviews recorded. Not everybody wanted that. That's okay. So we're working with those folks who asked for interviews. And what we're going to do now today is we're going to be interviewing Sam Jenkins Jr. He's the candidate for State Senator 39th District of Louisiana, which encompasses Shreveport, West Bossier, and parts of Cato Parish. I'll be giving him a couple minutes to do an introduction of himself, then I'll take it back over. I will ask each of the questions that were on the questionnaire. He will answer, and then he'll have an opportunity for a wrap up, and then we will close. So at this point, I really want to welcome Sam Jenkins and give him the opportunity for his introduction.
Thank you. My name is Sam Jenkins. I am a Shreveport native. I graduated from Southern University. I also have a law degree from the Southern University School of Law. I am a candidate for Senate District 39. I'm the only candidate in this particular race who has served at every level of government. I'm a former Shreveport City Councilman, a former Cato Parish Commissioner, and I'm in my second term in the House of Representatives. I do believe that background, that experience certainly will help me as a senator for Senate District 39. I certainly would like to say how much I appreciate the medical industry here in Northwest Louisiana. It's a large employer of our people in this area, but it more importantly serves a valuable service to the patient community. So I do have a very loyal background when it comes to supporting our medical school, as well as our hospital, Safety Net Hospital here, Oshner's, as well as the private hospitals such as Willis Knight and Krista Shumpert hospital system in this area. I've engaged them on many occasions to see what we can do at the state level, even when I was in the local governmental arena, what we could do at that level to make sure that this is a medical industry that grows and always be a very vibrant part of our area. I was married to the late Cynthia Hightower Jenkins. I am a father of two children, adult children, Atari and Anna. And I'm also a member of our church deacon board. So I'm very active in the community, have been very active in the community, and I'm seeking to go to the Senate so that we can continue to work on many of the things that we have been doing over the years in local government and state.
Well, thank you. And I want to thank you for your service in the House of Representatives.
Thank you.
Now, you're welcome. Now I'll go to our first question, which has to do with health disparities. Prior to the COVID-19 pandemic, we recognize that healthcare services are not accessible on an equitable basis nationally and in Louisiana. Healthcare is only 20% of what accounts for one's health status, and the social determinants of health are those non-medical factors that influence health outcomes. What strategies do you have to assist with reducing the social determinants of health impact on the citizens of Louisiana?
I do believe that the social determinants are something that must be addressed and something that, I have worked over the years to address. One of the more important things that I have found through my engagement in the community is educating people on healthcare. Believe it or not, there are many people who are not that much aware of things they could be doing when it comes to preventive health care. I am very appreciative, of the fact that many of our nonprofit organizations and faith-based organizations in this area do reach out and have health fairs. They go to the churches to educate on getting screenings, especially for diseases like cancer and other life-threatening diseases such as that. And we also try to do as much outreach as we can on smoking cessation. That can lead to a lot of health problems. So I support those efforts. I always will support those efforts. And I do believe that we can address, preventive health measures that we'll begin to see more and better outcomes for people who are now having an opportunity maybe to see a primary care doctor when they were not.
Thank you. Our second question has to do with nursing education and our faculty shortage. How would you advocate for federal and state funding to support the recruitment and retention of nursing faculty to help reduce the nursing shortage?
Yeah, the nursing shortage is a major concern, especially here in this area. I have met with the administrators of most of the hospitals here in our area, as well as our city leaders concerning the nursing shortage and the crisis that can be created if we don't have adequate number of nurses to tend to patients that are coming in. Some of the ideas that came out of that were one, to try to entice the retired nurses to once again become actively involved with some of the patient care. Also to try to see if there were ways to address any barriers that may exist with the Louisiana State Nursing Board as far as getting nurses cleared through the board, and to also encourage students, to go into nursing. We have a lot of our local colleges and universities that have nursing programs. I did file a bill during COVID to make sure that we paid our frontline workers, who included a lot of the nurses and people who were in medical care, hazard pay. We wanted to make sure that something like that was done. I would also advocate if there's any way for us to subsidize payments to nurses, to keep nurses in this area, or to recruit nurses to bring into this area to help with the nursing shortage. Any kind of funding, be it federal or state, that we can use to try to help in those areas. I would certainly advocate for that.
I'm curious, did your hazard pay bill go through?
Yes, it did. It went through the House and through the Senate, and we were able to pass $50 million in hazard pay to give to our nurses and others in allied health areas who are on the front line during the COVID, trying to get, some incentive there. So that bill did pass unanimously.
Well, congratulations. And on behalf of the health professions, I thank you.
Thank you.
Hard times. That was some hard times for folks.
No doubt about it. And that was a way of showing, our appreciation to those nurses and those who are on the front lines, dealing with a very difficult situation, how much we appreciate what they were doing.
Thank you. Next question has to do with safety and violence. And it's a two-part. Gun violence continues to roar through our communities, in our schools, in our houses of worship, in shopping malls, grocery stores, outdoor gatherings, etc., etc. What factors do you see as critical to bringing in an end to these senseless acts, and do you have a strategy to address the problem?
Well, yes, I want to work with senators and representatives who would at least agree that we should have some common ground when it comes to making sure we are keeping guns out of the hands of people who should not have them. We all know that we have the right to bear arms, and people want guns for safety, and there are those who want guns for hunting and things of that nature. So what we need is some common sense approach to it, as far as making sure that guns are not in the hands of people who really should not have them. Hopefully we could if we could get that conversation off the table and implement it in some kind of way, I think that we will see some reduction in gun violence. I do believe also, once again, we talked a little bit earlier about social issues that impact all of this. I think it's important that we began to look at these violent crimes, many of which involve guns, and what are the root causes of them. When you start talking about homelessness, unemployment, and poverty, talk about mental and behavioral health issues. And I'm a big advocate of making sure funding now go into the areas of mental and behavioral health. We need to begin to address some of those issues if we really want to start preventing crimes from happening. So I do want to have those conversations with senators and representatives going forward, see if we could put some resources behind preventive measures so that we could hopefully reduce crime. And not just from the enforcement end, which is also important, but I think we also need to try to make sure we're trying to put some preventive measures in place.
Now, the second part of that has to do with rapid fentanyl test strips. They can be used to determine if drugs have been mixed or cut with fentanyl. With important information about fentanyl, healthcare providers can take steps to reduce community risks of overdose. How would you support legislation to make those rapid fentanyl test strips more readily available?
I would do just that. I would support legislation that would make those tests available. I think it's critical, and I do think it's important. Many of us in the legislature this past session were really just not really being educated on fentanyl and the dangers that exist there. And so I think we were pretty much supported in many regards. One, to making any kind of test available, and two, to passing some criminal consequences for those actions. So I would support legislation to do whatever we can to deter the rapid spread and the danger that is being presented by the abuse of fentanyl.
Thank you. Next question, access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their education, licensure, and training?
Well, the answer to that question is yes. We need to make sure that healthcare is accessible and affordable. A large part of the Senate district that I'm running to is rural. I spent time in a lot of the small towns in the other part of Caddo Parish. There is a shortage of physicians in those areas and a shortage of clinics in those areas. To the extent that we can involve, nurse practitioners or others who are trained in certain areas to provide some degree of primary care, I'm not objectionable to that.
Thank you. And now the last two questions are general questions. What are your legislative priorities, Mr. Jenkins?
Yes, once again, I want to make sure that we are investing here in Northwest Louisiana in healthcare. Like I said, it's a major industry up here, as well as making sure that we're putting more funding into education, especially early childhood education. I want to make sure that our teachers are being paid, that we're keeping good teachers in the classroom. And I want to make sure that our schools are safe. I want to make sure that we are communicating between the school officials, local law enforcement, and others to make sure that we're deterring any kind of violent acts that can occur in our schools. I want to make sure also that we are bringing good paying jobs here in Northwest Louisiana. What we've seen here over the past couple of decades is many plants to close down: General Motors, Food Battery, Western Electric, AT&T, Libby Glass. There were a lot of plants that was hiring hundreds of people that are now closed. And we want to try to bring some of those industrial jobs back into this area. So I've been working in the House of Representatives across the aisle to do a couple of things. One, to make sure that we're going out and certifying some sites and locations for companies to come into this area, try to make sure that those sites and locations, that is, are shovel ready, somewhat so they could come in. And we also want to invest in our workforce and develop our workforce to be able to take on some of those jobs. I want to make sure that we're lowering auto and home insurance rates in this area. They're going up. There are many people who say that their insurance premiums are just as much as what they pay for their car note or for their house note or for their rent. That's much too high. We want to try to make sure that we are reducing that. I want to try to also take care of our retirees in this area. I want to be certain that our retirees can keep as much of their money as they possibly can. I passed the bill this past session to exempt the first, not passed the bill, I'm sorry, I filed a bill this past session to try to make sure that the first $10,000 of our retirees' income would be exempt from state income taxes. I want to try to bring that legislation back, in the Senate so that we can deal with those issues. Also, I want our state to be prepared for the fiscal cliff that is coming up. It's a serious situation. You're talking some $800 million annually that will roll off with the 3/4 of a penny sales tax. I filed a bill this past session to try to address that, not by raising the sales tax rates, but by keeping us the current sales tax rates and expanding the base. We're looking to try to now apply those sales tax rates to digital products because many consumers are now purchasing in that way. So we can expand the base and hopefully we can lower the sales tax rates if we have other areas that we could go in. So I want to make sure that we're stabilizing our budget so that we can fund the many state services that our citizens look up to us to do.
Whoa, that's a lot. That's a lot. Thank you. All right. The last and final question. Why should the Louisiana nursing community support you as the best candidate for this senatorial seat?
As I stated a little bit earlier, I'm in the House of Representatives. I've served 2 terms in the House of Representatives. Most of the medical community here in Northwest Louisiana is in my House district. The medical school, the nursing school, a safety net hospital with Ochsner, a major hospital such as Willis Knight and Sharp. I have relationships with these institutions. I've supported these institutions over the years and will continue to do so. I have a familiarity with many of the issues that they're facing, and I've been supported in many regards when I've been called upon to assist. So that is why I would hope that the nursing PAC will support me. You can count on me to be there for our nurses, for our doctors, for our allied health professionals, just as I've done in the past. So that is why I'm asking for that support.
Well, all right. So it gives us the wrap up. I guess maybe you just did. Do you have anything else you want to say, or would that be your wrap up?
No, I just want to say thank you for this opportunity to talk with the nursing PAC, and I hope that I could get your support. As I said, I will be accountable. I will be president on the job, and I will be supportive of the industry as a whole when it comes to healthcare.
Thank you very much. And again, the interview has been with current Representative Sam Jenkins from the 39th, running for the 39th Senatorial District. We thank you for your time, and we're wishing you the best of luck in your campaign.
Thank you so very much. I appreciate it.